All right, we're a 7:15 on Information Morning. Earlier this week on Information Morning, we told you Sydney's losing another doctor, in this case a vascular surgeon. The surgeon in question says the decision was not his, but was made by the Nova Scotia Health Authority. The Health Authority says it will not be renewing Dr. Ronan Jhirad's hospital privileges. The doctor says he's a victim of mobbing by staff and administration at the Cape Breton Regional Hospital. And Joan Weeks has been looking into his story. Hi, Joan.
Good morning.
So first of all, define mobbing.
Well, basically it means bullying, but by a group instead of an individual. So mobbing can happen in a school, a social group, or in the workplace. And in this case, the person who says they've been mobbed is, as you've said, Dr. Ronan Jhirad, who moved to Sydney in 2009 to work as a vascular surgeon.
And a vascular surgeon would be diagnosing and treating things like aneurysms, varicose veins, poor circulation?
That's right. Anything to do with veins and arteries, basically. And the surgeries they would perform include vein reconstruction, amputations, bypass surgery, as I said, anything vein-related. So not being able to operate takes away a very large part of a vascular surgeon's work.
Now, as of yesterday, Dr. Jhirad does not have hospital privileges. What reason was he given?
Well, according to Dr. Jhirad, he has not officially been given any reasons, but he says previously the hospital executive was concerned about, for one, poor resource utilization. Now, he says that means he takes a lot of time in the OR, maybe more than other surgeons. He says that may be true, but he feels it's the time needed to do a good job. Also, he says the hospital executive has been concerned about the number of disputes he's had with other healthcare providers. And Jhirad admits he has had a lot of disagreements with staff and administration, but he says they're related to quality of care issues.
So in what way does Dr. Jhirad feel that he's being mobbed?
Well, he says his criticisms over the years have annoyed and angered many people, and he feels as a result they don't deal with him fairly. In fact, he claims he's often not been given an opportunity to respond to complaints.
Some of them have not even been shown to me until years later. For instance, when my personnel file was given to me when we were reviewing my renewal of privileges, some of those materials I'd never been exposed to. They just were stacked up.
So basically, he feels the decision not to renew his privileges is not fair.
So what does the health authority have to say?
Well, Dr. Jhirad provided it and us with a letter giving it permission to speak to us, but it says even with a letter, legally it cannot, because of legal and privacy reasons, discuss any of these matters.
So have you been able to get any information from sources other than Dr. Jhirad?
Well, last year, Dr. Jhirad's lawyer hired a sociology professor from Waterloo University to investigate and give an opinion on whether or not he felt the doctor was being mobbed. And that's because Professor Kenneth Westhuse is a sociologist with a research focus on mobbing. Now, the health authority did not participate in this investigation, and we don't know whether he had access to all the relevant information. But Westhuse did cite information from Dr. Jhirad's personnel file.
So what are some things that stood out there?
Well, there were two alarming incidents described in the file. The first was on January 19th, 2010, and occurred in the emergency room. It says Dr. Jhirad cut open an emergency room patient from upper to lower abdomen without any sterility, without intubation or anesthetic, and with no anesthesiologist present. So I asked him about this.
That was a ruptured aneurysm. The patient was having CPR. She was dying, and the anesthetist hadn't arrived. So I did what was a rather dramatic thing and saved her life. It was a lesser of wake up when I clamped her aorta. I spoke to her later. She said she had no recollection of it. She had no adverse memories of the event, and she was very grateful.
So Jhirad says, it was a life or death situation. That's why he acted as he did. But he says he didn't know a complaint had been filed in that first 2010 incident until he got a copy of his personnel file in 2014. And he says, so the information that he cut open a patient with no anesthetic is in his personnel file, but there's no explanation from Jhirad himself or anyone else as to why that was done.
He remembers her waking up when he clamped her aorta.
And
you mentioned another incident that stood out?
Yes, it was a surgery in which the patient was under anesthesia for more than 12 hours, and the health authority brought this to his attention. They were concerned about that. Dr. Jhirad says it was a vein reconstruction that was extremely complicated, so it did take a long time. He says that patient is doing well today.
So what else is revealed in his personnel file, or at least as interpreted by this professor hired by his lawyer?
Well, Professor Westhue's report says between 2010 and 2014, there are between 20, depending on how you define complaints, there are between 20 and 40 complaints about interactions with Dr. Jhirad and staff. Now, following one apparently heated altercation with a nurse in 2010, Dr. Jhirad was reprimanded, days of OR time taken away from him. Now, in view of all the complaints, I asked Jhirad if perhaps some staff feel he is bullying them.
I define bullying as unjust coercion of other people. I don't think I was coercive for a matter that wasn't legitimate. I certainly made my case strongly at times, but I don't think I was physically intimidating or in any way abusive. I did swear on one occasion when someone slandered me.
And would you describe your manner in interaction with staff as aggressive in any way?
People experience it as such. I have a very emphatic voice at times. I don't think I scream, but I do make my case, I think, emphatically sometimes. The thing is, part of it is, I think it's about any times if you criticize someone or say that this could be done better, or we're falling short here, people automatically feel a certain animosity to you.
So once again, he thinks the fallout from all these complaints is that staff and administration have turned against him. Now, I did check with the College of Physicians and Surgeons of Nova Scotia, and they say there has been no disciplinary decisions regarding Dr. Jhirad.
All right, so this Professor Westhue, who is a sociology professor hired by Dr. Jhirad's lawyer, had written up this report based on what he saw in the personnel file. What was this sociology professor's conclusion? Yeah,
and he had other documents as well that they had obtained. But he concluded Jhirad has been mobbed, suggesting he became an unpopular scapegoat blamed for problems in the hospital. Westhue cites a 2013 Health Authority Satisfaction Survey in which half of the respondents, he says, gave their workplace a poor rating on communication, conflict resolution, and respect. Westhue says he could not find in the documentation good reasons why Dr. Jhirad should lose his practice. Least of all, he says, in a part of Canada where physicians are in short supply.
All right. And just to make it clear, that's a report written by a consultant hired by Jhirad's lawyer.
That's right. And the Health Authority did not participate in his study. So I contacted the professor and I asked him if he felt his findings might have been influenced by the fact that he was paid by Dr. Jhirad. Now, he says his goal is to offer all concerned a truthful and intelligible overall picture of events that have transpired. He says, I do not see myself as an advocate for the alleged mobbing target or anybody else.
All right. Do we have any idea how Dr. Jhirad's patients, or some of them, might be feeling about this?
Well, after the story aired a few days ago, CBC received correspondence from Donald Bird. He says he had an aneurysm and was sent to Dr. Jhirad for treatment. He was expecting to be operated on this June again. Bird says, quote, I'm now left out in the cold thanks to our government and the new policies and some of our local doctors. Bird describes another situation where a doctor left his area, and he said, quote, I think the point I'm trying to make is that it seems to be repeating itself a lot with doctors here, and now people have to wait a year or so to try and get to a doctor in Halifax. Gregory Lefort is 65 years old and lives in Glace Bay. He's been dealing with cancer and with heart problems, and Dr. Jhirad operated on Lefort for an aneurysm.
The operation was, it kept sitting here. People tell me I should have been dead and all that. Dr. Jhirad would let me know when things were happening or what he's going to do, and so easy to talk to. And it made the recovery part for me very, very good. I feel sad, like this here, and a little bit angry. The hospitals, like this here, don't let a good man go away, you know what I mean? But, see, not knowing what they're confronting each other over, like, I can't comment on any of that. But I can only tell you that they're going to lose a good doctor as far as I'm concerned.
So, Joan, that's a patient of Dr. Jhirad who's been told his ability to perform surgeries at the Cape Breton Regional have not been renewed.
That's right.
So where does this leave people who need the services of a vascular surgeon, all those other things aside?
Exactly. In a memorandum to staff and physicians, the Health Authority says Dr. Rex Dunn will be offering vascular consultations. He will refer cases and will continue to provide a number of surgical procedures. It says emergency vascular calls after hours and on weekends will go to the Halifax group. The health authority says it anticipates they will do temporizing measures and notify Dr. Dunn in the morning. It further says Dr. Dunn is prepared to continue to respond to limb or life-threatening situations whenever called upon by a healthcare site. Meanwhile, Jhirad says he will continue to do whatever work he can without hospital privileges, and he's looking for work and jobs in other areas. And overall, he suggests that in his experience, doctors should not be judging other doctors. He says there's just too much room for conflict, and he would like to see an independent body with some physician representation making decisions in situations like this.
All right, Joan, thank you very much.
You're welcome.
That's CBC Cape Breton's Joan Weeks in our Sydney studios. Right now we are 25 minutes after 7 o'clock on Cape Breton's Information Morning. You're listening to us in Sydney at 1140 on the AM dial. February.
Well, stay with the program, Steve.
I'll do what I can. I'll hang on till the end of the